Today we are going to discuss on porcelain veneers. So I'll make it into two brief sessions. So in the initial sessions, we'll have a brief introduction about what is veneer and the history of dental veneers and the indications and contraindications of porcelain veneers, as well as advantages and disadvantages of having porcelain veneers done in your mouth. So to start with, laminate veneers have evolved over the last several decades to become one of the aesthetic industry's most popular restorations. Laminate veneer is a conservative alternative to full coverage restoration, improving the appearance of an anterior tooth. So, moving on to the definitions of what is a porcelain laminate veneer. A thin bonded ceramic restoration that restores the facial surface and part of the proximal surface of teeth requiring aesthetic restoration is defined as a porcelain laminate veneer. Veneer means it's a thin sheet of material usually used as a finish. So laminating means constructing a veneer or bonding to it etched to the tooth structure. So it is the prosthetic treatment that consists of replacing the visible portion of the dental enamel with a ceramic substitute intimately bonded to the tooth surface, yielding optical, mechanical, and biological properties closely resembling to those of natural enamel. So moving on to the history, how did dental veneers actually evolved? So in 1930s, Dr. Charles Pincus first used thin resin facings and then air-fired porcelain facings to create something called as Hollywood smile to the American actors. So he was the first person who introduced having Hollywood smile for actors to have a total makeover of their makeover of the various Hollywood actors. So what he used to do was he used to use a denture adhesive to hold the veneer in place. In the 1970s, pre-formed plastic laminates were bonded to teeth using composite resins, but bonding to plastic was poor, along with color instability. So this is one of the few pictures of Hollywood smiles. So we have Zac Efron here, who's undergone a smile transformation. Nicolas Cage was undergone a transformation. Morgan Freeman was undergoing a smile transformation with veneers. And we have even Hollywood actress undergoing smile transformation. So how did we get this big breakthrough? So one of the biggest breakthrough in this modern ceramic veneers was with the discovery of acid etching by Bonaparte. So in 1955, Michael Bonaparte exposed the etching of dental enamel. So that was the most important breakthrough where we could etch the enamel surface and expose the underlying enamel rods, and whereby we can create a micromechanical retention with a substrate and a process on top of it. So later, as we all know, Bhavan's is GMA resins. So the resins, the bonding agents, the material, the substrate which we have beneath your composites or the cements are the one which is one responsible for it. And finally, the ceramic etching and bonding by Rochet. So whether we used to etch only the tooth surface. So ceramic or something similar to that of a glass, which could be etched, and anything which can be etched could be bonded. So that is how they came up with the concept of having bonded restorations. So it was with Rochet who introduced with the Rochet bridge where we had bonded restorations. So that's about the brief history of how the ceramics evolved. So as we have seen, it started all with the Hollywood smile, achieving ideal shape and size and color for the anterior teeth. Initially, they started off with plastic, which were used with denture adhesives. Slowly, the introduction of acid etching, as well as Bowen's resins and the various materials, they started bonding such processes onto the tooth surface. So, what are the major indications for such situations? These are not just for creating a smile change. It can also be a life change saving saver or life changer for certain individuals who has got tetracycline stains, fluorosis who had a devitalized tooth, maybe because of a trauma or resorption, anything. So tooth darkened by age to restore localized attrition and bone sensitivity due to segmental fracture. These are the various indications. Or we have to close if the patient has got generalized spacing and the space has to be closed immediately or maybe due to lack of certain situations where orthodontic correction was not intended or not the patient was not willing for such a correction. We could go for a veneer and even in correcting a peg lateral dental veneer is a good option. And as well for restoring an anterior guidance and mandibular incisors. That's like a higher end application of veneers. And sometimes when you have a chipped off ceramic facing, you can have the facing being covered or masked with the help of a dental veneer. Tooth fracture or restricted to incisive thirds. That's one of the most important common fracture which we could see in the anterior region where if it is difficult to do a normal restoration, we can opt for dental veneers. So at the same time, we do have certain contraindications. So insufficient coronal tooth structure, fractured teeth with more than one third of loss of tooth structure. So that means there's nothing to bond onto it. Or grossly caries or extensively restored teeth, full coverage restorations are preferred. Actively erupting teeth. Young individuals actively erupting teeth, since the position of the tooth and the crown height may vary, that is not indicated. Parafunctional habits like bruxism. So veneers are very thin processes where a person is a bruxer or having a parafunctional habit, there are very high chances for it to fracture. Severe pedonal involvement or crowding. So such situation it is very difficult to fabricate and have a veneer in such a situation. And a non-decayed treated teeth presents a very poor surface for bonding. And such situations, it is better to go for a full coverage restoration. So these are some of the contraindications for veneers. So now moving on to the advantages, as we all know, it's a very minimally invasive or a very conservative procedure. It can provide excellent color and light transmission with good aesthetics and high color stability, good tissue response, excellent durability, good strength, wear resistance, and no fluid absorption. And the speed and simplicity in the procedure adds on to its advantages. At the same time, for the tooth preparation, however minimal, is required. So once you touch the surface of a tooth with an instrument, that is for permanent or irreversible change which is going to happen onto it. Cementation is time consuming and technique sensitive. Since we need an absolute isolation during the cementation procedure as well as we require a total moisture control at the same time, it's more over a skilled technique because the path of placement is very has to be very accurate. So that is another disadvantage. And since it's a very thin process, it's very fragile and may break when we have such a situation if it falls off from the clinician's hand. So it has to be handled with a lot of care. And proper selection of underlying cement is critical for the success of aesthetics because since it is very thin, it is more translucent. So anything which is slightly darker than the shade being selected or the tool's shade will make it look more darker or may have a change in shade or a mismatch. And it is absolutely difficult to repair a fractured veneer. The best option is to cut through them, remove them, and go for a refabrication. And obviously, you do have cost factor coming into play when we talk about the ceramics, and that is going to be expensive when we consider a full mouth as canine to canine smile correction. So these are the various. This is what I wanted to discuss in the first phase of this lecture. We saw the what definitions for different postal venues. We saw the indications, contraindications, the history, and the advantages and disadvantages. We'll discuss the remaining part in the next session. Thank you.